Hi, my name is Dawn Hill and I'm recording this for Bio 230. It is Sunday, May the 13th at 11 p.m. I'm going to discuss the body regions and some anatomical positions. So, nice to meet you, Professor and Dr. Rodriguez. I will continue with the Kaplan Medical coloring book, which I'm using to study, and I will go through these terms. So at the top part of the page, we can go through the regions. Starting with the top, we have the cranial portion, the orbital, which is around the eye, the cervical, the mouth, which I found to be labeled as oral and buccal, and the neck region being called mental, up around the chin, the shoulder muscle being called the deltoid region, sternum, the sternal, the pectoralis muscle, the pectoral region, brachial up here by the bicep and the brachial artery, cubital over here by the elbow, the abdominal region and the umbilical, the antebrachial region being the forearm, coxal, the hip area, palmar region, the palm of the hand, digital, inguinal, just the interior, the region of the hip. Let's see, femoral portion of the thigh, patella being the knee, and the patellar region being the area of the knee. Behind the knee, which I will review when I do the posterior portion, which would be the popliteal region, the curial area being below, and cranial being up here, pedal being the foot, plantar being the bottom of the foot, and let's move on over here for the manus being the area of the hand, the pollex being the thumb, carpal being the wrist, and axillary being the armpit. I will move on to the posterior region of the body, and the top portion or area closest, like to the top for the head, the cephalid or cephalac area, the otic being the ear, the nuchal or the cervical vertebrae region, acromial being the process where the clavicle and the scapula join, the scapular region being back by the shoulder blade, the brachial again being the top of the arm, the vertebral region being the spine, the olecranon is the elbow, the lumbar region being the lower back, which is then followed by the sacral vertebrae, antebrachial being again the forearm, just we're looking at the posterior picture, gluteal, the region of the buttocks, femoral, again the posterior view, popliteal, the back of the kneecap, the sural portion of the bottom portion of the leg, the calf, calcaneal, again the calcaneus, the region of the heel. When we're talking about the proximal and distal areas, again we have the cephalid and the caudal, the lower portion down below of the heart, and then we have the tarsal portion of the foot, Going back up to the regions of the vertebrae, here we have cervical, and then thoracic, and then the lumbar vertebrae attaching to the sacral. Reviewing the planes of the body. Sorry, we'll go over here. Talking about the anatomical positions. We have the superior being at the top, inferior being at the bottom, medial being portion of the midline, and lateral being away, superficial being on top, and deep. Proximal is being above, and distal being below. We have the anterior and the posterior and back, ventral being on the side of the stomach, and dorsal being on the back. And yeah, that is about it that I have learned. Thank you, and I'm looking forward to this class.